Hi, my name is Kristen Stifflemire, and this is my student choice speech. Here at the high school, I'm a student trainer, which is part of our sports medicine program. This means that we take care of everything that has to do with sports like football, tennis, basketball, soccer, and even track. Being in the sports medicine program requires us to work hard, be dependable, and always be prepared. Basically, our purpose in this program is to provide water, aid in injuries, and work at the practices or games. So one of the things we do is provide players with water. We have tons of ice chests, coolers, and water bottles that we fill daily. So when it's time for practice, we fill them up with ice, water, and then take them out to the field. Also, we make water bottles, which are these. These are the bottles we use every day for football practice. We also put ice in these, and then we take these to the field too. The second thing we do is provide aid for injuries. When a player gets hurt during practice or a game, we have to rush over to see what happened. And always bring water. If somebody gets hurt, seriously hurt though, you would have to call an ambulance. This can happen a lot during Friday night games. If an ambulance is not needed, the injury isn't that serious. So the next day the player usually shows up for rehabilitation in our training room. When a player has a very minor injury, sometimes we get to tape them. Usually student trainers only tape hands, wrists, or blood from cuts. So right now I'm going to show you some of our tape and equipment we use. So first off, this is our packs. We keep all of our tape and scissors and everything we'll need for practice or game. So what we keep inside is Band-Aids. Usually we only use Band-Aids for small cuts or even blisters. And then we have Powerflex. This is used for cuts and blood. So whenever somebody's bleeding, we have to go and take them. And this is the gauze. We have to put the gauze wherever they're cut. Usually they're cut on their arms when they play football. So we put that and then we wrap it with this Powerflex. And then this is pre-wrap. We usually use this only for before we tape ankles and before we tape wrists, so that the tape doesn't rip their hair off. And this is the tape, which goes after the pre-wrap, and for ankles, wrists, hands. And then this small one is the finger tape. So this is only for if you have a jammed finger or cut, wrap them, buddy tape them. And then gloves for blood, for sure. So lastly, we get to work at practices and games, obviously. We work every practice in most games, mostly the football games, and some off-season sports games. When working practices and games, it is important to always be watching and ready for something to happen, because usually it does. We must always have water ready for the players, and we constantly have to fill up bottles. Also, we watch for injuries and take care of the players if needed, so we can ensure a successful game. If I wanted to pursue this as a career after graduating high school, according to the National Athletic Trainers Association, students who want to become a certified athletic trainer must earn a degree from an athletic training curriculum. The only downside, the Bureau of Labor Statistics says in May of 2010, the median annual wage of athletic trainers was $4,100. Which has probably risen slightly, but it's not as much as a medical doctor. But professional trainers get to be there for those intense football games and get to see all the action. So in conclusion, trainers perform many tasks on the job. We provide water, help injured players, make ice bags, and sometimes help with rehabilitation. Trainers must always be alert and aware of their surroundings in case a player needs something, and we are always there for the big win.